When a person comes to Caring Medical Regenerative Medicine Clinic with Ehlers-Danlos Syndrome, or for that any genetic hyperextensible condition where a person has joint instability, they might have a history of dislocating joints or their joints are hyperflexible, is to assess whether or not they have neck instability. Because if a person with Ehlers-Danlos has neck instability, that neck instability can cause things such as postural orthostatic tachycardia syndrome, mast cell activation syndrome, leaky gut, digestive problems, beside all the normal things that cervical instability causes, such as migraine headaches, dizziness, ringing in the ears, tinnitus, concentration difficulties, terrible fatigue, right? People with Ehlers-Danlos syndrome, fatigue is like a major issue, and people would have no idea that it can be just from cervical instability. So the way I assess cervical instability is by digital motion scanning. In other words, we basically take a movie camera picture of the movement of the bones with various motions of the neck. And that normally will show that the vertebrae are moving excessively. That can help target the treatment. So the treatment is actually cervical prolotherapy, prolotherapy into where the ligaments are damaged, where the extra motion is. And then once stability is restored, the symptoms start to go away. And for the person who has an abnormal curve, what we do is do cervical realignment therapy. So for a person with Ehlers-Danlos syndrome and cervical instability, we'd start with prolotherapy. Then eventually we would progress to various weights that are needed. Sometimes we use head weights and chest weights to help restore the normal cervical curve. So we're restoring the cervical curve and helping that curve stay restored because we've repaired the ligament damage from the Ehlers-Danlos syndrome or some kind of trauma they had. And the treatment is extremely successful for long-term relief, because that's what a patient really wants, is not just to get something that's going to help temporarily, but long-term get rid of the POTS, help their digestive tract, get back their energy, their focusing, and really just have a normal active life.